Prior to the pandemic, a lot of telehealth providers were built on kind of a direct-to-consumer model, right? Where they were really focused on selling telehealth services almost like a luxury service in a sense to individuals, right? With kind of the broad adoption of telehealth that occurred during the pandemic, I think a lot of that's changing. And what you're seeing a lot of maturation in payment models in the industry. So you're seeing folks move from direct to consumer arrangements to sort of enterprise arrangements with employers, and now increasingly to traditional sort of payer-provider arrangements with health insurers and health plans. The other thing we're seeing now is we're seeing a little bit more of an emphasis on value, in part because that's what's happening in the payment industry, and in part because I think that's becoming increasingly a big differentiator for telehealth providers. CMS introduced a lot of flexibilities that permitted coverage of telehealth services during the COVID-19 public health emergency. There was a little bit of uncertainty as to what might happen with those once the public health emergency ended, but as it turns out, most of those flexibilities anyway have been extended through the end of 2024. So in a sense, no change. I guess the question really kind of is, okay, what happens after 2024? Given the way things are going, we're not going to see any pulling back, right? Telehealth is kind of here to stay, right? The question is, are there tweaks around the edges with respect to things like payment methodologies or utilization management requirements, or things that are more patient-focused, related to confidentiality, related to treatment choice, that sort of thing?